Hi, ladies and gentlemen. Thank you so much for tuning into the COVID-19 lockdown account. Today, I've got Achal with me. Achal is a business owner who owns Yoga House over in Bangalore in India and is currently in solo isolation. Achal, how are we today?
We are very fine. Jerry, how are you doing?
I'm good. I'm good. I'm getting to talk to people from all over the world like yourself. So I'm very humbled and blessed by that at the moment. But
Mhm.
very interested to hear your story actually. So if we were to go back in time, right the way to the beginning of lockdown, what was the feeling
Mhm.
and what's your experience been throughout this whole period for you?
So yeah, I mean, I think I'm quite used to being on my own because one, I'm single, so I've lived alone for a long period of time. But my travel and my job actually involved me traveling quite a bit. So this, for example, I would say I would be on a plane almost every week to travel to for work. But yeah, this has been quite a bit of a change from that kind of a lifestyle. I've been on my own without any help. Also, so I'm doing the household chores myself. I also learned to cook in these 2 months. So there are some new skills that I have helped myself with. So yeah, it has been an interesting experience from a perspective of learning new skills, being on my own and surviving on my own. Earlier, I used to live alone as well, so psychologically it was not much difference. But from a physical perspective, where you are always provided some help, that was not available. So I kind of learned to be on my own and doing everything on my own.
Yeah.
So yeah, that's been my experience. Being locked down.
Hmm. Hmm.
Um, and obviously, when you're on your own, then you have much more time. So I have tried to, be constructive with it. Trying to be physically fit. I used to teach yoga regularly earlier as well, and now when I was locked down, then I was not able to actually be teaching. So I kept up with my practice, at least twice or thrice a week, and now I've started online classes as well. So that's kind of taking care of my fitness.
Mm. So managing to pivot online, that's amazing as well, which I think we're seeing a lot of people doing. Is that something that you think you might continue into the future?
Yes, I think one, when you are doing a class in a physical space, then there is always a restriction in terms of the number of people you can reach. Now here, I've been able to do a class in which sometimes I had people from Bhopal, which is my hometown, and then people from Mumbai who were my students earlier, and even one guy from Seattle who was my student in Mumbai. So I've been able to do a class in which I have audience from all over the world. So
Yeah.
yeah, that's been a nice experience as well. So I think I would be actually continuing to do classes, and even from the perspective of doing a yoga business like yoga house, there would be an opportunity for that business to also
Hmm.
pivot itself to an online model now.
Yeah. And
Hmm.
what platforms are you using for that? Are you using Zoom, Facebook? Are you using anything like that?
Right now, I'm using Zoom.
Yeah. Yeah.
Yeah.
I think that's probably been one of the greatest inventions ever that's come out because, which has helped with this pandemic where we can just communicate so much easier. We're on Zoom right now. And, you know, if, if,
Absolutely.
if this hadn't been available, it would have been catastrophic, I think, in some respects for business anyway. So when you're going to kind of move into the future, what kind of
Mhm.
things can you see happening or changes, especially in India right now, that haven't been done before?
So I think, one, if I talk from the perspective of the business travel, I think we would realize that, with the, tools like Zoom, which are now available, probably we will not to travel that much for business. So
Mm.
one thing that I can foresee in future is that business travel is going to take a hit. And because of that, I think a lot of the business for, a lot of the hotels and their business will get affected. And I think maybe aviation will get affected as well. So people now will not travel that much because now the tools are really, we are realizing how important Zoom is. I am conducting meetings every day, with my staff in sales, with my staff in factory and production. So I'm able to communicate face to face like I'm talking to you with most people. And I think that removes the need for physical travel to these locations. So one thing for sure I feel would be the need for physical, travel. That will, I think, reduce in terms of business. And from the point of view of also, yoga and the trainer that I am, and I train people, I think I was not able to reach out to some of the students who wanted my classes. So, with this, the opportunity, and I think has come where we can actually reach out to those people. So I'd actually recorded my voice in a group of, students, which was in Bhopal and was used to my style of classes. They just wanted, my voice to be recorded, and they were doing for almost 2 months. They were doing classes according to those voice instructions. But now that, we have started doing classes on Zoom, it's much more convenient. And I'm sure this technology is also going to evolve and, be more suitable for, teachers reaching a vast audience of students that they want to reach.
And I think this time has also made a lot of people be aware of their mental health. I think people have had time to connect with their spiritual side as well, to realize that escaping your mind is the best way to kind of heal and reset your mental focus. And there is a huge calling for people to be able to do that en masse, I believe, especially when it comes to mindfulness, yoga techniques, meditation. And I think that needs to be done still in a group setting, but definitely in your own home. And I think that what you're doing is, it is really, really needed right now, really needed. So, I'll take my house. Really do.
Mm-hmm.
So
no, I think definitely people are resetting their goals.
Yeah.
In terms of what they were doing with their lives. I think a lot of people are now introspecting. Whether they actually need to have that kind of life where they are unmindfully consumerist, and they would like a lot of consumption. Whether people can live in less and be more happy. So I think the way people define happiness may also change. Whether just being a consumerist, whether that's what is bringing you happiness, or whether you can live with limited means and yet be happy. I think this is a question people are now actually asking themselves, because they are able to live with much less. Now they may not have to have so many clothes, they may not have to have so many shoes and bags and things like that. So whether that actually contributes to happiness is also under question now.
And I think what you just said there, the material things, lockdown has taught us all. I mean, I've got a wardrobe, I'm guilty of this, and I've mentioned it in other podcasts and other interviews, that I've got quite a big wardrobe, got lots of clothes and stuff. I've got other clothes that I wear for like holidays, for like skiing and stuff, up in the loft.
Right.
And it makes you think I don't need hardly any of it. I mean, stuff I have to have for necessity. There's coats and stuff for the winter. Obviously, we're a lot more seasonal over here in the UK than probably over in India. But so we need a lot more variety of clothing. But even
Right.
the amount we've got, the amount of stuff we've got, I've worn this, the same style of t-shirt every day throughout lockdown, and probably the same pair of trainers, a pair of footwear. And you just think, why have I got so much? What do I need that for?
Absolutely. I agree with you.
Which is mind-blowing when you think about it. Absolutely mind-blowing. So tell me about in the early stages of your lockdown, because we've got a bit of a time lag on our computers here, due to obviously you're over in India and I'm over here. So I'm going to give you a little bit more time window to answer, because I keep cutting you short. I do apologise. But if we go back to the start of lockdown, okay, talk to me about the kind of things you were doing and have done all the way leading up to now. A bit of a timeline of things you've done, how your mindset's been has had to adapt, and what point you decided to pivot online. Just talk to us about your process and your experience throughout lockdown from start to finish.
So yes, I think I had to, kind of take care of the basics because, that was the first time when there was no domestic help available, even in the guest house that I'm staying. So in terms of, cleaning, in terms of, washing your own clothes, in terms of, cooking your own food. So initially I had to understand, what are the sources of food or stores which are available in, which could, provide me with food. So the first thing actually I attended to was the basics. So whether I had enough food with me which I could cook, and also I thought in terms of nutrition. So what is that I would want to eat in this time, because there is very limited variety of things available. So what should I be eating, and whether so I am a sparse eater any which way. I don't eat too much, so I kind of looked at few things which provided me with protein, and like for example eggs, and vitamins and minerals through some of the vegetables. So I kind of ensured that at least I had some of the essential things that I usually eat or I should be eating with me. For example, things like pomegranates or watermelon, or beetroots, and eggs and cheese. So I kind of ensured that I had some amount of food like that which was available. And then I of course looked at some of the recipes which would make some of these things more edible in terms of the taste. So I learned a few things to make with even beetroot, which is usually very tasteless and not palatable. So I focused on that, and of course in terms of the hygiene and in terms of cleanliness, in the house. So I got the basics, for example, hand sanitizer, because whenever I was going out, and the masks. So I just prepared myself with the essentials and the basics right in the beginning.
Mm-hmm. Mm-hmm.
And of course I was fortunate that there was a store which gave me a Swiss ball. So I kind of got a, because I had no other equipment for so I got a Swiss ball which is there with me, and I've been kind of training some of my specific muscle groups that I thought I would want to work on because I have more time now. So
Mm-hmm.
for example, I want to build a little more of my core strength, so I've been working on that. So yeah, I ensured that these things were in place. And of course, the other thing which was very essential was connectivity. So I ensured that whatever plans I had with the mobile phones and the SIM cards that I had, I kind of upgraded those with connectivity, so I had enough bandwidth, because at this point of time this is the most essential thing. So yeah, basically taking care of the essentials was my initial plan. And then of course I kind of built on a little bit of variety, because how much of food like that you could eat on a longer term basis. So then later on I learned some new recipes, and yeah, I think at least the good thing is now is that I can cook for myself, which I think I feel very proud of.
Mm-hmm. Mm-hmm. And what kind of things did you see in and around the country doing? Like, what was the general what was the general population in India doing? Were they following guidelines? Were the police out in force? Were the army out? How were things restricted, and how was it enforced, the lockdown?
Yeah, there was a little bit of police presence, but I think people by and large were quite scared, and they were complying with the guidelines. So that was the case. I did not see many people kind of not following the guidelines. So everybody's eyes found outside was wearing a mask, and even in the shops where we were going, there were hand sanitizers, and people were kind of scared. But I think this is just the limited population that I interact with, because I'm staying in a reasonably affluent part of the city. And I think the images of the migrants which were around, and there is a very large population of migrant labor in India. You can say that it was in the range of about 100 million people, which is quite a large population. So they were suffering quite a bit, and their images kept coming back to us. And it kind of also made us introspect, and also be more grateful that we actually have so much more and security in such a large population. And then I also got involved with some charities which were actually reaching out to these people and ensuring that they were getting food, and some of these migrants were also being helped to arrange their travel plans so that they could travel back to their hometowns. So yeah, it was a little tragic, phase of life as well, where you saw so many disturbing images, and which you are not aware of usually. So yeah, there was a little bit of a sadness around, and I thought I would like to get involved with something that could help it.
And
So yes, yeah.
And especially with things like homelessness, and we had, and we've got a small problem compared to India's,
Yes.
Yeah, renowned homelessness issue. How was that, yes, either policed, or how was that kind of aided during the lockdown?
Sorry, can you repeat your question? How was that?
How was it aided? How did the government step up and help that, or was it a case of?
So yeah, so the government actually tried to, run some special trains where these migrants can, go back to their homes.
Yeah.
And I think the community also, there was a lot of community feeling. So wherever these people actually started to travel back, because, they could not. So people have actually walked almost 500 to 1,000 kilometers. So they're, to reach back homes. And whatever their routes were, there were sometimes, people, citizens who, as community tried to help them, tried to provide them with food and walking shoes and slippers and clothes and things like that, so that they could, reach back home. Government has done its bit, but I think it's the whole lockdown process, I think, was a little hasty, and there was a large population which was not given a chance to reach back and be prepared. And I think we saw the consequences of that playing out on the roads later, and then many people actually died on the way. Many people died of hunger and malnutrition and things like that. So so we saw both the sides. I mean, one side was the lack of planning from the government, and the other side was actually the communities coming out and opening up their hearts and purses to help these people. And as we speak, it's still happening in the a large part of the country. People are still suffering and walking back to their hometowns, and many of them are without any jobs, without any money. So yeah, that's quite a sobering situation outside.
It's always, whenever there's a crisis, it's always the people on a very, very low income that suffer the most, when it comes to anything from war to famine to pandemic. It'll always be the poor that suffer, which is terrible. But the one thing that I think that the world can say is the levels of kindness and understanding, help and gratitude that has come from this is, has never been seen before, and hasn't been seen in my lifetime. And I think it's the kind of communal feel that they would have had during the Second and First World War, especially in places where they were being hit by the war, more so the second than the first, and I think that level of community is the one thing that we can seriously take away from this very turbulent and very difficult time. And I hope that level of understanding and help will continue, especially over here. But I think that we can learn a lot from each other through this time as well. So talk to me about people that you're connected with. Are you still in contact? Is there people in your family that you talk to, friends and stuff? Has technology helped in that way?
Yes, I think, technology has really helped. I think, we are in touch with our family. I've been in touch with many of my close pals, not only in India, but around the world. So, we have been sharing information so that we can be, better prepared. Also, the sense of loneliness that some people are facing, it gets mitigated a little with, the technology available now, because, we are able to see each other, talk to each other, share, what we are doing, share, what problems we are facing, and if there are solutions, we can actually tell each other. So I think technology has been quite a beneficial thing in such kind of a situation. And the sense of being isolated is not so severe at this point of time.
Mm, mm. And have they given any indication of when you guys might be coming out of isolation or out of lockdown? Because we're in the 3rd of June at the moment. So you guys have been in for about 10, 11 weeks, haven't you?
Yes, it's been almost close to 11 weeks now, from March 22nd. So 10 weeks, 11 weeks now, in this lockdown. So the lockdown has now started to relax. So there are, many relaxations which are there. And I think the interstate travel, which was kind of banned, is also going to be eased, and people can now travel interstate. There are certain flights operating now. So, trains have started to operate. So travel has become, easier. But yes, only those people I feel are traveling now who were stranded and who were not in the places where they should be.
Yeah.
So as this, becomes kind of eased up, then, people will start traveling back to at least their bases. And whether they would actually travel, for any other reason right now, I don't think so. People will just get to their base, feel comfortable there. There are still certain containment zones in India. So, those there are no relaxations in those containment zones. They still, remain locked down completely.
Yeah.
So yeah. So I think some easing has started to happen, but it is happening at a time when, the cases are spiking now. As we speak, almost for the last 3 days, we have 8,000 new positive cases in India. 8,000 plus, which has been the highest number. So we locked down when we were up only 600 positive cases, and now we are active cases are more than 100,000, and total cases are about 200,000. So whether this will contribute to more quick spread of the disease, it's still to be seen. So we are yet far from the peak of the pandemic.
Yeah, I think they're expecting that now. And you said that some places are still in full lockdown. Is there a kind of a code as to why certain areas have to stay in lockdown? Is there a condition, for instance, that a criteria that an area has to meet to be able to come out of lockdown?
Yes, I think I don't know the exact distance from the active cases, but where there is a cluster of active cases, it's identified as a red zone, and then it gets completely locked down. Now, how many people need to be in that cluster? I'm not exactly aware, but yeah, if there are people in that cluster, if there is for example, even if there is a building, and even if there is one positive case in that building, it will be a containment zone. So, it will get kind of completely sealed off from the rest of the city.
Mm. And how about travel to and from the country, for instance, other than internal travel? I'm assuming that no one can come in, no one can come out.
Yeah, the international flights are not, open as yet. So the aviation minister is now talking about middle of August to September, when they feel that international flights can get opened up. But the situation is changing so rapidly that we don't know. If things fall into place much earlier, maybe this will start early. But as of now, commercial international flights are still about 2 months away. We are sending some rescue flights to places where Indians are stranded abroad. So they are trying to bring them back to the country. So that those kind of flights are operating. Of course, the cargo flights are operating. The courier services are on. So yeah, that's what is happening right now in terms of the aviation sector.
Which is, it's very hard to get your head around, especially people living in the like listening to this in the future. It's almost, you can't compare it to anything. And well, we don't know what the future is going to hold, so we don't know whether this is going to be the new normal, right? So you just don't know, which is crazy. And like I say, we've been in lockdown same amount of time as India. Pretty much about 22nd, we got told to shut our facility, which was the businesses that I own, and then on that following Monday, which I think was around about 24th, we got told to not leave the house, which we haven't really been doing since. But I can imagine, like everywhere, there are now groups of people, certainly in the UK, that are kind of ignoring social distancing rules, and all over the world there seems to be a form of protest as well due to things that have happened over in America, awful things that have happened over in America. So I think, is there any sign of that over in India?
Any sign of?
Signs of people ignoring the rules, or any form of protest or anything?
Yes. There is a large population, which is, not in the place where they should be. So, and we have slums, and when people are living in slums, there is no social distancing that you can observe. So, for example, the population density in a place called Dharavi, which is, one of the largest slums in the world in Mumbai, the population density is 2 million people per square kilometer. So you can imagine, that's the kind of, population density we are dealing with. And of course, you cannot have any social distancing there. So people are forced to, but yes, I think there is a large population also, which is a little careless at this point of time. And they're thinking that, now that the government has started to relax the lockdown, that means the disease has kind of, gone away magically, which is not true. So I think we will pay a price for that. But yes, there are quite a few number of people who are also not observing the, lockdown rules, correctly as they should be done.
And when it comes to healthcare in India as well, what does that look like for people that maybe come from a very underprivileged background?
So actually, the state is supposed to take care of, the health. So we have government hospitals and doctors on paper everywhere, and it's supposed to. But the facilities there are so neglected and so unhygienic that the anybody who has a reasonable amount of money would never want to go there, and that's the reason there is such a large private healthcare industry also prevalent in India, which is because it's healthcare, they are able to even fleece people at times. So yeah, I mean, there is healthcare available for everyone, but the facilities are very, very pathetic. And at this point of time, when certain government hospitals are actually converted into COVID hospitals, there is both kind of reports. So I know a doctor personally who is managing a 1,000-bed hospital somewhere in Haryana. She is a classmate. She is a director, and she has she got 120 COVID patients, and she cured all of them and discharged all of them. So there was, it's a government hospital, so it was such a commendable job. But I also get a report of government hospitals in Mumbai where there are like 30, 40 people in a ward, and just 3 doctors are kind of taking care of them. The healthcare support workers have kind of run away because they're scared of, contamination and scared of the disease. So both kind of pictures are emerging. There are certain people who are doing a very good job with the government facilities, and there are certain, government facilities which are not able to cope up with this kind of a pandemic. Especially situation is quite bad in Mumbai.
Yeah. I spoke to a mutual friend of ours who's in Mumbai, and she said that the situation was quite interesting, to say the least. And although there's a lot of good, I think there are certain areas that definitely need addressing and need looking at, really. Do you think that the government might look at the conditions of these hospitals now that this pandemic has been so, has highlighted that there is such an issue with them?
I'm losing you, I think.
Oh, sorry. Do you think that the government may take another look at these hospitals because of COVID-19, and it highlighting the fact that they do need updating?
Yeah, I mean that would definitely be one of the objectives of the government to take care of the such pathetic conditions which are prevalent in these hospitals and try to improve that. I think we need more allocations in our budget towards healthcare, and I think after COVID, I guess there would be an awareness whether in government and also in communities that healthcare is really the essential thing. So let's try to improve the facilities with for healthcare, and also it should be available to the most underprivileged of the classes which are there, because everybody has a right to good health. So
Yeah,
I think there will be awareness, and because it's such a kind of milestone event in our lifetimes, this pandemic, that it will probably get people, get communities, get the government to at least prioritize what is most essential.
yeah. I think there will be a lot of good that obviously it's been horrendous and catastrophic what this awful pandemic has brought to light, but I think there's going to be a lot of light at the end of the tunnel, and some amazing good that the human race is going to come out of this, and hopefully some of the feelings of kindness and gratitude will spread and continue for forever. Well, it would be a nice idea, wouldn't it? It would be a nice idea. Well, Achal, look, we're going to come to a bit of a close now, so I'm going to ask you a last couple of questions. And thank you. First of all, you've given amazing
Sure.
insight into what you've been doing over in India, and giving us some fantastic feedback into what the Indian government have been doing as well, which is is going to be extremely valuable for years to come. So, on a personal note, would you say that or have you been given any feedback, or have you been given any advice by friends that, or it could be anywhere, even a post online, that has really helped you through these times? Oh, I think I might have lost you there.
Yeah, I think I think I've been watching some inspiring things, and one of the things that inspired me, because you see death and dying all around you. I actually looked at some of the videos of a free solo guy called Alex Honnold. I don't know if you know him. He is one of the free solo rock climber in the US, and he
Uh-huh.
climbs mountains which are like 3,000 feet without any help, without any ropes or support. And during that journey, he's all the time with death, actually. So I've been kind of looking at it, and I'm trying to understand that that we all understand that everything is impermanent. You know, we are all mortal, but I think this is a thought which should be with us when there is pandemic and when are these kind of calamities around you, that nothing is permanent. So make the most of the moment that you have, and don't think of so much in future. You don't know what is there in it, but and thinking of the future, which is kind of imaginary, you are letting go of these precious moments which pass by
Mm.
unattended to, unnoticed. So yeah, I think this is one thing, and one documentary, or you can say, which has inspired me in these moments. And so that is something which has really been inspiring. And this was introduced to me by a friend who took me rock climbing about 3-4 months back, and then he sent me this clip of this guy. So it's really been helpful.
Well, I'll look him up, and more importantly, we'll put some links to anything that you advise we kind of have a look at, or anything that's inspired you. We'll put links to it in the show notes anyway. I've got one
Okay.
last question for you, Joe, which is, if you could go back in time to right the way at the beginning of the lockdown, and you could give yourself one message or one bit of advice, what would that piece of advice? What would that piece of advice be, and how would that have helped?
So I think that advice would be, of being self-dependent in everything, whether you need it or not. But I think you should know the skills to survive on your own if you are in any kind of situation. And for that, you need to, obviously, the most important thing is your health, because, without health, you can be in a situation where you could do something, but you would not be able to do it. So I think taking care of your physical, mental, emotional, and spiritual health, which of course yoga helps you with, and which is my, a part of my lifestyle. I think I would advise people to, always remain healthy, so that they are prepared for moments of life which are not good and which are good. So, that would be my advice to people.
No, I love that. And I'm going to make a note of that straight away. That really is extremely important. All the points you said there, and I think that's a fantastic piece of advice to give anyone or to give yourself. Be self-sufficient and work on your mind, body, and soul. Yeah, I think it is a mantra I try and live by as well, and I think that we need to push that out there, especially to the younger generations that are living through a very, very strange time in history. Achal, we're going to put in any links to your websites, to your business, especially like the yoga house as well, because you've now gone online. We'll put all the put all the links in the show notes there, as well as anything else that we can help other people with throughout this interview. And I just want to say a massive thank you to you for doing this and for coming on board.
Thank you very much, Jerry. It was a pleasure talking to you, and I wish you, health, happiness, and safety in the times to come. Thank you.
Thank you. Well, look, don't go anywhere, because I'm going to talk to you after this off screen. But for the rest of you, thank you so much for listening. Now, if you have enjoyed today's session with Achal, please do let us know by giving us a cheeky comment in the comments bar below. Also, if you'd like to help other people and you'd like other people to experience what you've just experienced during this podcast, please do press that share button and get us out there on social media so your own friends and family can enjoy it just as much as you have. Also, if you do feel like you've got a voice and you'd like to help me on my gargantuan task of interviewing 100 people during the COVID-19 lockdown, please get in contact with me via ABC Gym on Facebook, or just chucking a cheeky comment in one of the podcast comments bars, and I'll be in touch within about 48 hours. Achal, thank you so much for this today. It's been an absolute pleasure, and I look forward to speaking to you again in the future.
Thank you, Jared.